inviting me. I'm Davide Rossi, a clinical neurophysiologist who works at the Neurological Institute Carlo Besta in Milan, Italy. I'm sorry, again, because my camera doesn't work, so I can't show you my face, but I don't think it's a must-see for you. So, okay, I'll try to explain what we did in the simplest way possible. Okay, this is the study design. We all know that crocheting and knitting can produce positive effects on personal well-being, such as relaxation and relief from stress. However, less is known about the effects of these craft-end activities on the attentional brain networks. So we focused on the attention. The study was promoted and supported by the Gomitolo Rosa Onlus, a non-profit association that encourages the recovery of native wool, and is committed to projects for the increase of the well-being of patients engaged in the medical therapies through the promotion of the textile-related arts among them. So, but after Dr. Costa probably tell you about this activity. My thanks go to all the enrolled volunteers and especially to Dr. Costa and Dr. Ivana Polloni who supported us in the execution of this study. In the present study, we investigated for the first time the short-term effect of the crochet on the performance in a well-known attentional test and in the global cortical functioning networks revealed by magnetoencephalography in a group of crocheters compared with the sex and age-matched control group. The magnetoencephalography that we know as MAG is a functional neuroimaging technique that can map the brain activity by recording the little magnetic fields produced by the electrical currents occurring naturally in the brain using very sensitive magnetometers. So what we did, the protocol included 5 phases. First of all, a MEG acquisition in resting condition, the execution of the attention network task, 20 minutes of awake resting, or crocheting for the crocheters, MEG acquisition in the resting condition, and the execution of the task after the crochet or the rest. The whole protocol took place inside the shielded room of the MEG for a total duration of about an hour. All the volunteers adequately carried out the protocol. Surprisingly, we found that crocheting improved global reaction time, alerting and orienting networks, but not executive control. What are alerting, orienting, and executive control? Attention is probably composed of 3 separate anatomical and functional systems, that is to say, alert, orient, and executive control network, which, albeit independent, cooperate and influence each other to produce an adaptive and performing behavior. Our result provide for the first time the crochet is associated with an increase in attentional networks, namely in alerting and orienting networks, paving the way for the use of textile-related arts in neurorehabilitation. So we are very proud to show you as this study. Thank you again for the invitation and thank you for all the support that we have received from Gomitolo Rosa Onlus.
Thank you very much, Dr. Rossi. It's a pity that we cannot see you, but I don't know if there are questions from the audience. The most important, I think, message is that this is one of the few real scientific methodological studies showing the impact of crocheting on the mind we have 2 or 3 people crocheting in the room here. You could see them. And could you just say a few words more on what we mean by increasing the attention? Because in my experience of surgeon, I remember so well that patients who were crocheting after the operation, for example, the day after the surgery, in fact, they were more calm, less anxiety, but also it's true. I was surprised of the attention when I was trying to explain how the operation went and what will be the exercise to do and so on. So how would you comment the fact that crocheting can increase the attention? Attention is a broad term.
Yes, attention is a term by which we can use the mind to focus our point to one thing with respect with another. This study paves the way to the use of the crochet and knitting in the neurorehabilitation, as for all just for example, for the stroke rehabilitation or probably for dementia rehabilitation. And another thing very important is that in line of your experience for in the oncological patients, we can say that patients not only have a stress relief before a communication or during the therapy they had to do, but probably before a meeting with a doctor can improve their ability to learn the important message from their doctor. So it's very important that this study can confirm what you experience in the real life.
Thank you. Very good. So we can now